Hi everyone, I'm Milo Melino, the Women Student Liaison, and I'm speaking with you today from the unceded stolen lands of the Tsleil-Waututh, Squamish, and Musqueam nations. And today I'm going to talk with Dr. Jeda Boughton. I hope I have pronounced that correctly. Surnames are quite difficult somehow. Sometimes I know mine is it's terrible, one of mine. So I'm really sorry about that. And please correct me anytime. Hi, Jeda.
Hi, Maya. So I'm Dr. Jeda Boughton, and I own a an integrated wellness clinic in Vancouver, BC. Personally, I'm a doctor of traditional Chinese medicine, so I do acupuncture and herbology, and there's a few other things that I do, shockwave therapy, laser therapy, and then other like nutritional therapies and things like that. I work with other women who provide acupuncture and Chinese medicine, and an osteopath, a couple of RMTs. We have Pilates instructors, and we have a kinesiologist on staff as well, and nutritionists. Right now, it's just a large group of women working together. So it's been just us for a long time. So it's been really fun, actually.
Sounds great to have like a good team of women.
Yeah.
The dream. And I would like to ask you, I'm not going to ask you like how it is to be a woman in your field, because we all know it's hard being a woman in any field, but you work like with women's medicine as well, right?
Yeah, so we do a lot of women's health and a lot of hormone health and reproductive medicine. We treat everyone. We treat men and women, but the majority of what we do is women's health.
Is there anything that like it's really like in your experience as a doctor dealing with that it's really pressing on women's health that all women should like be aware of and they usually not?
Well, we do a lot of reproductive medicine, whether you're trying to conceive or not. And a lot of women aren't really aware of their cycles and their hormones. I think people, once they do go through a fertility journey, they start to learn a lot more about themselves. But for the most part, what we find is that until somebody's trying to conceive, they just, a lot of times there's just not a lot of thought put into hormones and hormone health and that kind of thing. Or until there's a problem, like if there's pain or things like that happen.
Yeah, that sounds fair. I would like to ask you about something that I've been reading a lot lately, especially because my sister has it, some friends have it, and it looks like a really big health issue that is not enough talked about. That's endometriosis.
Yeah. Yeah.
Can you tell us like a little bit about what it is and how it usually manifests? I don't know if that's the word for it, but
like what it comes from, how it starts.
Yeah, like because for example, my sister has it, and it took like, I'm not kidding, it took them like over 20 years to find out.
Yeah, it's
that she
not
had it.
It's not the easiest thing to diagnose, and often with Western medicine, they're just looking for things. They'll do ultrasounds and laparoscopic, exploratory, just looking to see what's happening with the endometrial lining. But basically, what's happening is part of the endometrial lining that's in the womb is displaced outside of the womb, and there's different ideas about how that happens. Different theories, and we don't really know, but sometimes they think that it can go through the fallopian tubes and then it comes outside of the womb. So you get this endometrial tissue that's really receptive to estrogen, and then you get the cycles of estrogen throughout your month. And what happens is when estrogen rises, that tissue actually thickens up, and that's where we get, with our menstrual cycle, where we have the tissue thickens up, and then the estrogen event, if you're not pregnant, the our progesterone will drop, and then the bleed comes. But if that tissue is not inside the womb, then it's bleeding outside the womb. So it could be in the perineum, like it could be anywhere in the body. I've had patients who've had it in their nose. I had a colleague who had a patient who had some kind of weird wrist issue. So it was like she would get a bruise there. So somehow the endometrial tissue got confused and ended up in a different part of the body. But generally what happens is it attaches to something else. Like it can attach to the bowel, it can attach to the ovaries, but it attaches outside where it's not supposed to be. And then every month you get this pain because you have this tissue that's estrogen receptive, and then it waxes and wanes just like your period does. So, but as far as knowing how that manifests, it's not a really, really well-known problem, but it's not an uncommon problem. So we treat it a lot, and we can help a lot with the symptoms that arise because of it. It's, like a lot of times in Western medicine, they just will diagnose it from, like, if a woman has severe pain or has large menstrual clotting, those types of things, or sometimes they'll do imaging, but it's not necessarily an easy thing to diagnose.
Oh, that's very interesting. I even reading some things about it. I was not aware that this could be like, it could go like a rogue tissue that could go anywhere.
I know, it's crazy to think about it. It's like some kind of, yeah, exactly. That's a good way to put it, rogue tissue.
I was like, I'm gonna take a walk. Woo! Around your body. Yeah. Don't do that, buddy.
Yeah.
Can you so you are a specialist in non-Western medicine, right? What do you think like are the advantages of like not like non-Western medicine compared to Western medicine? Because that's how I see it, but Western medicine seems to be like very disease driven,
Yeah.
and very based on just like the exams you said, like imaging and like searching for something, but like specific, and not seeing the whole. That's the way like I see it, but I don't know if there's a misconception if that's.
Well, I think one of the important things is to keep in mind what the medicine is really good at, because Western medicine is really good at acute injuries, trauma. They're really good with infections. It's basically an emergency style medicine, or people call it heroic medicine. So if you have like something that's acute or life-threatening, immediately life-threatening, like a car accident, a broken bone, or you have an infection or something that needs surgical intervention, or even with diagnostic imaging, Western medicine rules, right? It's really good at those things, but it's not good at long-term care. It's not good with preventative care. There's a lot of things that it's lacking. So it's kind of, I always think of it like, if you're going to use a tool, use the right tool. And if you need Western medicine, you need it, then use it. And if Western medicine doesn't really have the tools to treat what it is you're looking for, then look for a different style of medicine. And Chinese medicine and acupuncture and naturopathic medicine, we have a naturopath as well on staff, and is a lot better with things like endometriosis and hormone health, and things that aren't as as well treated by Western medicine. So the two of them would be perfect if we worked together.
Oh yeah, that's what I was gonna say. Like they
Yeah.
should like complete each other.
Exactly. When I was in China, I worked in a hospital in China, and I worked in a hospital where they integrate the two, and it was awesome, because if you needed to do something with Western medicine, you just send the patient there, and if they needed us, they came to us, and sometimes the two would work together. I mean, a lot the two would work together, and it was really great. And I'd say that's probably one of the drawbacks of our system.
Yeah. Food for thought.
Yeah.
Okay, my next question is not so medicine related, but like, you know, but uh, who inspires you, especially women? Like, do you have a woman that inspired you
So
that
yeah,
is a like, role
and these
model?
are yeah, sorry. Um, the women that inspire me from a Chinese medicine perspective, um, well, I mean, and I have Sharon Weisenbaum is one of my teachers, and she's very inspiring. These aren't going to be people's names you've probably heard before. She's a master of Chinese herbology and Chinese medicine, and she's just brilliant. And Clara Cohen, she's actually a good friend of mine. She's very inspiring when it comes to business and also when it comes to Chinese medicine. She's got tons of energy and tons of knowledge and really good person to kind of lean on when I have business questions and those kinds of things. There's another woman that's does a lot of obstetrics in Chinese medicine. Her name's Deborah Betts. And you know, like I said, the probably not common, well-known names, but those are the people that I kind of lean on for information and also just watch what they do and I'm super inspired by their energy and their knowledge.
Thank you. Um, yeah, they don't have to be like famous women. It's just like what speaks to you. That's totally fine.
Yeah.
Yeah, sometimes I get a little lost
Yeah.
on my train of thought. Like, I'm sorry, it's Saturday morning. Okay, let me phrase that. What would you like to say, like, to every woman about like health on a like, I don't know if on a Chinese medicine perspective, but something that everyone should be aware of, or more um, like pay more attention to when it comes to their health, because like you said, like sometimes people don't know their cycles or how their hormones work, and that could be like bad, like because you have, you know, you have a problem, like something is not working well, but you can't actually pinpoint what, because you don't know exactly how your body works. So would you have like anything that you'd say like, hey, pay attention to that, it would be nice because your life is going to be a little bit better?
Well, the interesting thing is a lot of times when people come to see me, I ask them a lot of questions. Like, so one of the benefits of doing what I do versus doing, say, being a GP is I get to spend time with people when I see them in my clinic. And I have a, you know, we'll go through a whole health history. We look at how every aspect of your body is working. And one of the things that's quite common is when I do talk to women about how things are working, they think when they have something that's uncomfortable, that it's normal and that everybody has it. So let's say, for example, I ask somebody about their digestive system and I'll say, you know, do you get bloated? And they'll go, well, everybody gets bloated. And I'll say, well, actually, no, not everybody gets bloated. So one of the things that I'd say to pay attention to is if there's something uncomfortable in your body, it doesn't mean that it's not common, but it's not ideal. And it doesn't mean that everybody has it. And the other thing that I've noticed too over the years, I've been doing this for 21 years now and doing reproductive health. And a lot of, you know, when we grow up, we're told, you know, if we look in the wrong direction, we're probably going to get pregnant, right? So, so it's like, do everything you can not to. And then we don't realize that when we want to get pregnant, it might not be the easiest thing. So a lot of times women aren't really aware of their cycles, like I said earlier, or their hormone health or that type of thing. And sometimes women will wait until they're in their 40s to try to get pregnant, and they don't realize that they're not 20 anymore. Even though they feel good and they feel youthful and they're still getting their cycles, it's not as easy at that point to get pregnant, and some women can't once they hit their 40s. So just being aware of how their body is feeling and aware of how their body is feeling in what they eat, what they do, their activities, things like that. And I don't know, I think it's important for me, I guess, and of course I'm in this field, but I think it's important to have like kind of a healthcare team And that includes your GP, and that includes Western medicine, and it also includes somebody that can guide you in a more holistic way.
Yeah, that was exactly what I was gonna say. Like ideally medicine would be like a holistic thing where everything would get together and we would be able to treat what is pressing with one thing and what can be like preventive with another thing. And wouldn't the world be amazing if we could give that to everyone?
Yeah,
It would be
but some
amazing.
people, a lot of my patients have put that together for themselves. So they'll have somebody, they'll have a physio, and they'll have a chiropractor and a naturopath, and then see me, and then they also have a GP, and I help them guide them a lot in which tool they need to use at what time. Because sometimes, like we're not always all aware which tool we need at what time in our lives.
Yeah, that makes sense, especially if we are not like into medicine or
Right.
I don't know. I'm very curious and I read about like very weird things like how those laparoscopy works just and I'm gonna watch a video just because I think it's interesting. But I know that's not like people are not gonna usually do that, I think. Just
Well,
like, how this works.
now we have YouTube, we can watch anything, right?
That's the amazing one of the amazing things of the internet is not just for cute cats,
Yeah.
but cute cats are very important too.
Yeah, that's true.
I was gonna ask you, you think that what you said about women being very willing to say, "Oh, but everyone has that. Like it's uncomfortable, but it's a minor thing," or always like minimizing what they're feeling. It's because like usually they are brought up to feel like very uncomfortable in a lot of settings, but also to like they're raised to be like, "Oh no, this is just how life it is."
I think a lot of women are, yeah. They don't want to complain, right?
You're kind of brought up to be like, "Oh, you need to
Or
be
just,
tough because otherwise people are gonna think you're too soft. You're exaggerating."
yeah, maybe. I mean, there's definitely, I can't, yeah, I mean, it's an interesting way to think about it, right? It's like, well, because I get into the room with somebody and I ask them a lot of different questions, and sometimes they're things they haven't even ever thought about before. And some people are like, oh, I don't want to complain about that or whatever. And it's like, well, it's not about complaining, it's about getting the facts, right? Let's talk about what's actually happening. So I think you're probably right. It is probably related to, oh yeah, I don't want to seem like I'm complaining.
And unfortunately, we've been seeing like on the media sometimes, and some research about it, that uh, the pain women when they go to like emergency services or things like that, they have their pain dismissed more than male patients do. That's also like a racial thing that where it says that BIPOC people also have their pains dismissed as lower uh, by uh, the people in charge, like the medics and stuff like that, uh, as opposed to like white people. They have their pains
Right.
like taken to more into consideration, and that happens like with like women and men too. Like so, apparently there's this gap where women's pains are not seen as real or as intense as men
Yeah.
pain.
Yeah. I can see that. There was a study done on menstrual cramping, and some men had hooked up some electrodes to themselves and were trying to recreate it. And then they were like, "Oh my God, this is pain. This actually is pain."
That's what I
Because
love about science.
because when it comes to like endometriosis, yeah, exactly. I had a patient who her husband just didn't take her seriously, like he was like, "Oh, it can't be that bad." It's like, yeah, well, it's like if you don't
Yeah,
have it, you don't necessarily know, right, how it feels.
yeah, it's the always like think a little bit about the other. Like maybe what the word is lacking a little bit is empathy,
Yeah.
but that's a whole. other conversation.
Yeah.
Well, thank you so much
Yeah, you're
for coming and talk to us. This was really enlightening, and I hope all the other students think that too. Thank you. Like, I cannot thank you enough. This was really, really amazing. And is there any other thing like that you would like to say, or maybe, yeah.
um I don't not really. I think one of the things though, you know, with young women that I see and some of the things that they're looking at doing with their lives and going to the university and you know, I start seeing people, I see babies and I see teenagers and teenage girls and um one of the things that I would like to encourage people when because I know this is like sort of about women and women in business and that kind of thing is really think about what you'll be doing on a day-to-day basis when you choose your career and get to know other people who are doing what you think you want to do and find out what their life is like. Because when you go to school and you take, you know, you take 4 years or longer to develop your knowledge and figure and, you know, before you even jump into the career, it's a lot of time and energy. And I think a lot of times people don't think about what it is they're going to be doing on a day-to-day basis before they start working or before they decide what they really want to do with their lives. So I just wanted to encourage that. I feel like I'm so fortunate to have chosen what I chose because I love my job. So, and I know you guys you're this is going to be going out to a lot of students and I see a lot of students as patients and you know, I see a lot of people who've been in careers for a long time and they're like, "Oh, I didn't know I was going to be doing this." So,
That's that's one of the most amazing things I've heard. Like, for sure. Yeah, that's
yeah.
something students need to hear.
Yeah.
Well, thank you so much
Okay.
for participating.
Yeah, thanks for having me, Maya.